If you'd like to look a little younger and fresher, but feel you're a little past where toxins and fillers would do the trick, a vampire facelift or PRP facelift may be for you. Let's take a look at what it is and how it works. Why do they call this a vampire facelift? Very simple, because it uses the patient's own blood as a source of growth factors to stimulate collagen and elastin growth, creating a youthful, rejuvenated look. When you draw blood and you put it into a special type of centrifuge which separates the cells from the serum, the layer in between is called the buffy coat. And the buffy coat, which is very tiny, contains the platelets, and the platelets contain the growth factors. And growth factors stimulate our cells to make the collagen and elastin that we had when our cells were young. As we get older, you lose the ability to make that collagen, and the elastin, which is the stretchy part of the skin, becomes less. And so stimulating these to grow again creates a youthful look. So now that we understand how this procedure works, it's easy to understand where the term PRP or platelet-rich plasma facelift comes from. You spin the blood in the centrifuge, the heavy red cells go to the bottom, the clear liquid's at the top, and in the middle is this little tiny coating called the buffy coat, which contains the platelets. The goal is to take a needle and syringe and get this layer out and re-inject it into the skin, stimulating the growth of collagen and elastin and creating that young, rejuvenated look. Sometimes I see people that come to me and they say, well, I had a procedure like this and it didn't work. And one of the common reasons is that it's very hard to get that little tiny layer out with a needle and a syringe. When somebody does this a lot and they're using the more modern technique, a laser separator is used, in which it's a machine with a glass chamber. And the glass chamber is disposable. It's only used once because the patient's blood is inside of it. And the chamber spins, and a laser can actually see when that blood is separated properly and can open little valves to suck out each layer. And it's laser controlled as the light shoots through the little tubes to see what is actually coming out of that glass chamber. And then you get a great sample that you know is pure PRP. And you know that you've got a procedure that's most likely to work. So how do we do this procedure? The first step is that we draw the patient's blood and put it into this machine that's the laser separator. And it takes about 15 or 20 minutes, and the machine very precisely separates the red cells, the serum, and the buffy coat that has the growth factors. The red cells we discard. The serum we keep, and we're going to use that at the end of the procedure for microneedling it back into the surface, and I'll explain that in a few minutes. Once everything is separated, what we do is we numb the area that we're going to be injecting the PRP in, and it's a combination of topical anesthetic and Novocaine injections. And in my practice, we use a type of laughing gas called Pronox. And Pronox is a mixture of oxygen and laughing gas that the patient actually can administer themselves to the level that makes them comfortable. That's how safe it is. And once the patient has the local anesthetic, topical and injectable, and the Pronox on board, so they're quite comfortable, we inject the PRP throughout the face. And what happens is that PRP immediately begins to stimulate the collagen elastin. And we then take fillers, hyaluronic acid fillers, Juvederm, Restylane, Voluma, and we fill the areas that we know have deep creases. And now you've got one helping the other. The PRP facelift is helping the injectables, and it's found that doing that together is synergistic. One makes the other work better. And so a PRP facelift is really a combination of using fillers and using platelet-rich plasma. At the end of the procedure, you see very little. There's some irritation, a little bit of redness, pinkness, but There are no open wounds. The needle marks that are there go away very, very quickly. And usually there's some swelling the night of the procedure, but by the next day, most people go back to most of their business, work, play, etc. And there's really no recovery downtime from this procedure. Afterwards, you begin to see the results in a matter of days. But it takes as long as 6 months for the PRP to fully work and stimulate those cells to make that collagen and elastin. And what you see is a tremendous decrease in fine lines, open pores, deep creases, acne scarring, and a tightening of the skin. And so people look dramatically younger after this procedure. How long does it last? Like any other procedure, you're getting older the next day, but you've set the clock back permanently. You always look better than if you hadn't done it before. Many people will do this procedure once a year a few times and then every other or third year. Some people do it once and never do it again. That's variable patient to patient. But what we do know is that without an actual surgery, the stimulation of the collagen and elastin, the tightening of the skin, the filling of the wrinkles makes a dramatic improvement, certainly far beyond that we can achieve just with toxins and fillers. And most people are thrilled because there's no downtime. After this procedure, you're back out and about immediately. So I hope that answers all your questions about how a vampire or PRP facelift works. I'm Dr. Joel Studin. For more information, take a look at my website and my YouTube channel. Thanks for listening.